Hey guys, it's Derek Z. In my last video, I covered total knee replacement rehab part 1 for the initial phases of rehab. In this second part of the video, I'm going to be going over how to restore strength and function in the knee. In this phase of rehab, you'll likely have restored your range of motion, quad control, managed your swelling, and have a pain level that's low or at least tolerable. It's important to have this criteria met, mainly because in this second phase of rehab, the strengthening exercises require a little bit more load to the knee. So if that's the case, meeting this criteria will allow you to progress through the second part of rehab process a lot smoother. Here are some of the exercises I have my patients do when they're in this phase of rehab.
So the first exercise is a basic bridge. This is the only exercise that's on the table. The majority of them are standing because the knee is a low bearing joint. So the bridge is very straightforward. You lay on your back, knees are bent, and feet is about shoulder width apart. Squeeze your butt, and then you extend your hip, bring it up, a couple second hold up at the top, and then you bring it down. I usually have my folks do 20 to 30 of these, depending on what they can or cannot tolerate. If this is too easy, the progression is a single leg bridge. So you extend this, assuming this side is the side that you have surgery on. You press down on that, bring this up, keeping still the thighs parallel with each other, and then still extending the hips. The next exercise is gonna be heel raises, just basic simple heel raises where you just pop up onto your toes. The most common compensatory pattern that I see people do is they tend to rock into it, that's not really what you to do. You just want to stand, and it's a straight vertical movement. Usually I have people do about 30 of these. If that's too easy, grab onto something for support, and then you come up on single leg heel raises. Again, you're doing this on both sides, so it doesn't really matter which leg that you had surgery on. Just know that the leg that you had surgery on is going to be the side that's going to be a little bit weaker and harder to do.
Squatting is the next thing that we need to get back to doing. So when we squat, about shoulder width apart, hips go back, back stays straight, and then you're just going down as far as you can go. In the beginning, when you're doing this, it'll likely, if you had surgery, let's just say you have surgery on this side, you'll likely want to lean your weight away from it. So when you're doing these squats, make sure you do it in front of a mirror so you can kind of give yourself a general idea whether you're going down with equal weight bearing or not. If this is getting easier with the squatting, you would just grab a kettlebell and then you would just load the squat that way. Keep the kettlebell close so then that way you're not leaning forward with the weight. Toe raises or tibialis raises are the next exercises. These work on the muscles in the front of your shin. They play a role in help you with the ability to walk a little bit better, mainly because it helps bring your ankle up. So these are nice exercises. All you gotta do is just find a wall or lean against something that's stable, have your feet out a little bit, and then you're just bringing this up. And again, usually people do this about 30 times. If these get easy, you progress to single leg, and then from single leg, you also just bring that up. These are a lot harder, so getting the 30 of these are going to be a little bit more of a challenge. Lateral step down is another nice exercise to help develop eccentric control in your knee. This is a very important exercise I have people do because it's single limb loading. So this is important, and it should translate over to especially when you're going downstairs. That millisecond when you're going downstairs that you need control, this is where the exercise is to help you with that. So you start off with a box. This is a 6-inch box. You can start off with something that's shorter to make it a little bit easier and then progress your way up. So I usually have a 4-inch, a 6-inch, and an 8-inch box. I just start in the middle here just for demonstration's sake. So in this position, what you want to do is, let's just say the leg that we're working on is the right side. You go ahead and bend your hip backwards. You're coming down in a little bit of a squatting position. Tap your heel. Most of your weight is still on this side, and then you come up. When I have my folks do this, I usually have them break it down into 2 sets of 15 or 2 sets of 10, depending on what they can tolerate. Side stepping with a TheraBand around your ankle is a nice exercise to help with hip stability while you're walking. Also helps with lateral movements and lateral stability as well too. So you start with the band on your ankle. So there's actually 3 different positions for this. You can have the band in your knee as the easiest, and then having the band going down to your ankle as the second level, and then the last one is stepping on the band, but having the band on the forefoot. That would be the hardest one to do. So I'm gonna start off just on the ankle. So when you start off, make sure that there's already tension on your band, and then you take a big step and a little step. When you're doing this, make sure when you're sidestepping, there's still tension within the band while you're doing this. I usually have people go about 20 times one side and then 20 times the other side. Single leg balance is going to be the last exercise. There's multiple tiers of progressions in this exercise, mainly because you do it with eyes open, and if it gets easy, you do it with eyes closed. And then if that gets easier, you change the level of the surface, making it a little bit more uneven. And you can do that. We do that in the clinic with a foam. And then if that becomes even easier, I have people stand on the BOSU, and then eyes open and then eyes closed to make it a little bit harder. So the first progression would be just find something stable that you can grab onto. Start with, let's just say the right side is the one that we're working on. Stand on the one leg. For the sake of safety, grab onto this. Once you feel like you find your center of balance, then let go, but keep your hands close. So if you're tipping over, just grab on. 30-second hold is typically what I have people do, total of 3 when they're doing this. Once this gets easier, you close your eyes. It gets a lot harder once you close your eyes. You can see my ankle's working a lot harder. It's a lot more wobbly. And once you can do this for 30 seconds 3 times, then what you do is you change the surface. So I have a piece of Airex foam right over here. It's just a soft piece of foam which generates an uneven surface. You do the same thing on here. Single leg stance or single leg balance on this. 30 seconds, still standing next to something that you can grab onto if you're tipping over. Once you get good at this, close your eyes. That gets a lot harder once you close your eyes, but you know where you are. It's safe, mainly because you can just grab onto this if you're tipping over, and then 30 seconds. And then if this gets even easier, we change the surface again to a BOSU. This is the BOSU. Not everybody's going to be able to get here because this level of exercise is not going to be in everybody's everyday activity. This really works on the knee, the ankle, and the hip, and the trunk. The idea is the same. Stand on that side, grab onto, start with something close by so you can use that for balance and safety, and then let go. Still go for 30 seconds. And then once this gets easier, go ahead and close your eyes. Then you're really working. And you would still go for, like it's a struggle for me, 30 seconds. That's what you're shooting for. Eyes closed, that would be, at least in our clinic, that's going to be the hardest thing that we can have for static balance. But again, not everybody can get here. If you can do just single leg balance on the foam or just on the ground with eyes closed, that's already really good. That's all I have for you guys in terms of the strengthening phase and restoring function to the knee part for a total knee replacement. If you have any questions, please feel free to leave them in the comment section below, and I'll see you guys in the next video. Thanks for watching.